The impact of telemedicine on healthcare accessibility. Imagine the following scenario. You are feeling you are extremely unwell, and you have to go to the hospital, and you think of getting to the hospital. It's crowded in there, and you're even scared of maybe someone being exposed to something that might affect you. You simply decide to take your phone, you open an app, you speak with the doctor in minutes, you get your prescriptions, you call the pharmacy, and boom, you're out. So such is the strength of telemedicine. My name is Kingsley Mba, and today I'll be bringing to you the speed of how telemedicine is transforming the healthcare industry. Yes, as someone who has researched extensively on how telemedicine has revolutionized the way we access medical care, whether you live in probably in a dense, crowded city or you live in a rural area, telemedicine is bridging the gap between the healthcare practitioners and patients. First of all, what is telemedicine? Telemedicine is described by the American Telemedicine Association as the digital communication technology that provides healthcare services remotely. That is, it permits patients to access health practitioners in remote areas. This can probably include tele or video conferencing with doctors, remote healthcare monitoring, and even diagnosis using artificial intelligence. Telemedicine probably became widely known during the COVID-19 pandemic, when hospitals were overcrowded, were overwhelmed with patients. Patients needed alternative ways to access care. But before that, telemedicine was being used in rural areas to connect patients with specialists who couldn't otherwise have access. So, how does telemedicine improve healthcare accessibility? Let's start with the rural areas. Millions of Americans live in rural areas, and there is an increasing shortage of doctors in these rural areas. In fact, the U.S. Healthcare Resources and the U.S. Health Services Administration reports that approximately 80 million people live in areas with limited access to healthcare providers. So telemedicine does provide these individuals to receive timely care without them traveling to long distances, or maybe getting maybe to the hospital and having crowded lines and overwhelmed, like the hallway is always crowded, and probably some of them end up even dying just because of the time. So another major benefit about benefit for patients with mobility use of chronic conditions. Many people with disabilities or probably serious illnesses, right, struggle to visit doctors. They don't have access maybe to drive maybe to the doctor's appointment. So they use telemedicine to link up with their practitioners, with their doctors. So telemedicine eliminates these barriers of allowing to consult the doctor without leaving your home. Imagine you sitting at the comfort of your home and talking to your doctor, and in less than a minute, the doctor, your medication is available at the pharmacy. So this is the power of telemedicine. Even for those in rural areas, it offers convenience for them. No more taking time off work. So probably you have to take on work because you have to attend to your doctor's appointment. You can just sit in your office and talk with the doctor, and boom, everything is done. So, however, this teleconferences, for example, it has its own limitations, right? It has limitations. So, for sure, it has the drawbacks that it brings. Is one has the biggest issues of accessing technology, right? Most of, especially the elderly, right, they don't have access to modern technology. They don't know how to. Probably you tell an old mother or an old father to use the Android phone to tap, to tap, to tap, to tap. So according to the CMS, the Center for Medicaid and Medicaid Services, about 25% of the elderly patients struggle with this digital technology, making it very hard for them to access medicine. In addition, not all insurance company or insurers may may allow their patients to do telemedicine because they think it's not accurate and they won't probably pay for the services. So the other problem is the human factor. Many people prefer to have a face-to-face, right? A face-to-face interaction with the doctor. So it makes them even feel more comfortable, more convenient. Why video calls are sometimes they may lack personal, or maybe there might be a connection issue with the internet or whatsoever, or maybe the carrier may have some problems. So it makes it very difficult for them to access the doctor. So in conclusion, what does it mean to the future of healthcare as a whole? Telemedicine is not a replacement for traditional healthcare, but a useful tool that enhances success. It allows those in rural areas to access care, helps those with mobility issues, and provides those with busy lifestyles. However, to allow telemedicine to reach its full potentials, we must address concerns like access to technology and insurance coverage. As healthcare evolves further, telemedicine will play a key role in shaping a more efficient, accessible, and patient-focused future. So next time you are sick, imagine you would maybe ever go or leave your house, just call the doctor and get prescription, and boom, you're good. Thank you.